G8.
If you suffer from pelvic pain or incontinence, a female urogynecology specialist could answer a lot of your questions. Dr. Ahmed Akl with AZ Urogynecology and Pelvic Health Center is here with more. Good morning. Good to see you.
Good.
So,
how are you?
What is a urogynecologist? How does that differ from urologist?
Sure. So a urogynecologist is a subspecialist off of urology or off of gynecology. General urologists do 2 more years of training to become urogynecologist. General gynecologists do 3 more years of training to become a urogynecologist, to a total of 7 years either way.
Wow.
So it combines selected aspects of urology, gynecology, and colorectal surgery to treat women with pelvic floor disorders, fecal incontinence, or urinary incontinence.
Yeah, so what are a lot of the female conditions you can treat when women come to see you and they suffer from all this pain?
Absolutely. So pelvic organ prolapse is the biggest female pelvic disorder. Approximately 2 out of 10 women will suffer from pelvic organ prolapse or urinary incontinence or fecal incontinence. We also treat women who have vaginal mesh or complications from vaginal mesh, any painful bladder syndrome, also known as interstitial cystitis, urinary incontinence, obviously. And to a lot of women, urinary incontinence is just incontinence, but there are a lot of causes that cause urinary incontinence. There is leakage when women cough, laugh, sneeze. That's called stress urinary incontinence. There is urgency or frequency where women don't make it to the bathroom. That's urgency incontinence. There's overflow incontinence. And all of these types of incontinence are treated in different ways. So it's really important to know what the cause of incontinence is. We also treat women who have fecal incontinence, and again, fecal incontinence has many causes to it. So it's basically you have to identify what the cause of the problem is before treating it.
So what are some of the treatment options available for women?
Well, it varies. There's conservative management, there's definitive management. Conservative management comes down to medications or pelvic floor physical therapy, which we'll talk about hopefully later. There's also definitive management in the form of minimally invasive procedures or surgical management in a definitive manner.
So what is pelvic floor rehab and who benefits from this?
So pelvic floor rehab is an excellent treatment option for women who have pelvic organ prolapse, urinary incontinence, pelvic pain, or fecal incontinence. It's basically a subspecialty off of pelvic therapy, physical therapy, for women to have pelvic floor physical therapy. So it is a subspecialty off of physical therapy for women to undergo a pelvic floor physical therapy by a pelvic floor physical therapist. It's 1 session a week for 12 weeks typically. It's internal pelvic floor physical therapy, so women go through a routine of behavioral modifications, bladder retraining, pelvic floor muscle retraining, with progression to strengthening and a home exercise program so they can maintain that therapy for the rest of their lives, basically. It's 66% successful in treating urinary incontinence, 75% successful in treating fecal incontinence, and it varies with pelvic organ prolapse. If it's really advanced, women wouldn't really benefit from it. If it's still at an early stage of prolapse, they would benefit from that, and it also varies with pelvic pain.
And I'm sure you've helped so many women who have probably suffered years with this pelvic pain and have had no relief. Tell me about your locations and how can people get a hold of you?
We have 2 offices. We have one in Mesa by Power and Baseline. Our second office is in Scottsdale. It's by 92nd Street, Mountain View Plaza. And women can just reach out to us through the phone. It's the same number for both offices, or online. They can feel free to look us up. Patient satisfaction is really big for us. We have 5 out of 5 ratings, and we take women very seriously and their satisfaction and their problems very seriously.
And you have years of experience, which is just so important. Dr. Akl, thank you so much for coming in. We appreciate it.
Yeah,
and if you'd like to learn more information about AZ Urogynecology and Pelvic Health Center, visit their website, azurogyn.com, or call the number you see right there on your screen.